This is Dr. Manisha. I'm currently working as a medical lead in Medical Affairs Division of Lupin. On behalf of my team, I would like to give a very warm welcome to all of you in this brief discussion on patient awareness program on PCOD and mental health diseases. As we are aware that women are quite vulnerable to the mental health conditions in their entire life during their adolescent age to the menopausal age due to various reasons, biological, environmental, social, or multiple reasons. And changes are occurring in these periods. People who have been diagnosed with PCOD are more common, are likely to be diagnosed with anxiety and depression than people without PCOD. So our team has brought together distinguished personalities from psychiatry and obstetric and gynecological field in this forum to celebrate the PCOS Awareness Month in September, as it is essential to spread the word about the condition and its challenges faced by many women from eminent experts in this field. So joining with me today are Dr. Vidhya, who is a consultant psychiatrist from Madurai. She had done her MBBS from Coimbatore and MD at Madurai Medical College. And she has also worked as assistant professor at Velama Medical College for 5 years and currently full-time consultant at Sri Karwana Clinic, Madurai. Another panelist we have is Dr. Kabilarajee, who is a gynecologist. She had experience, 12 years of extensive experience in obstetric and gynecology. She had trained from prestigious institute, Stanley Medical College, Chennai, and infertility specialist trained from Kyle's Institute, Germany. And she had also been trained in laparoscopy and trained under Dr. Mishra from Delhi. So with this brief introduction, I would like to take this discussion forward, as we are aware that PCOD is a very common disorder and mental health illnesses also. I will pose the first question to Dr. Kabila. Ma'am, how PCOS is common? How the women with PCOS affects in general? And is there any connection between PCOS and mental health illness?
Yeah, so to take out this question, I can answer you in a brief way that more than 80% of the females are suffering from this PCOS. Just from adolescence till the age of premenopausal stage, this PCOS invade the female population. So one in three suffering from this PCOS, and side by side they are having the mental issue because of their disordered menstrual cycle. So definitely they need some mental support and counseling part from the psychiatrist that can help their lifestyle and it can improve the quality of life. So it's a challenging situation. We both can handle that in a beautiful way.
Right, ma'am. Thank you, ma'am. Now, next question is about how these two conditions are linked together to Dr. Vidhya. Ma'am?
Hello, I'm Dr. Vidhya, psychiatrist. I think this is the right time to talk about the mental health impact due to PCOS. So as ma'am told, like in the major part of the reproductive age of women is they have a major disease which is very commonly prevalent. That is from right from adolescence to the premenstrual or menopausal age, to even before menopause. As rightly mentioned, PCOS is like spans between the reproductive age group of women, and it is like we can call PCOS as an emotional roller coaster where there are lots of interactions between the hormones, the psychological factors, social factors influencing the outcome. The mere diagnosis of PCOS itself will cause a lot of distress in the women, especially when the girl is in their marital age. Okay, and it also influences the marital life of the women also. So it can start from a simple distress or a stressful event with lots of mood swings, extending up to a lot of disorders, including depressive disorder, bipolar disorder, even like we've seen patients expressing deliberate self-harm thoughts because of the diagnosis of PCOS. And also the process of managing PCOD is also like it is not acceptable by women or easily acceptable, which in turn causes a lot of stress. So definitely there are a lot of mental health impacts because of this disorder.
Yes,
More
correctly said,
prevalent.
ma'am. Yes, yes. Thank you. Thank you for these insights. So as we understand that these both the conditions are interlinked with each other and they causes the impact on both on each other. So Dr. Kabilarajee, because PCOS patients are coming to first to for gynecological consultation you first. So how you can able that may lead to patient may having some mental health disorder symptoms. How do you identify these symptoms?
Yeah, if it is an adolescent age group, when they are with their peer groups, when someone is getting their cycles regularly and when they are not getting it, they feel they are not having some abnormal uterus or something which is so they are losing their femininity. And when it falls into the reproductive age group and it is due to that they are falling into that infertility, they feel that it is a sin that I am cursed to have PCOS and I am not able to have my normal reproductive cycle and I am not able to have a baby. And when it goes to the premenopausal age group, because of PCOS, they are falling into obesity, diabetes, and multiple things. So when they are falling for that, they are thinking that I am having multiple medical disorders and how to handle those issues. In one or other way, they are handling with stress and depression, and because of that, they are having another episode of irregularity boost of hormones. So it's main thing that they have to control their stress and everything to have a regular cycle, because this good hormone has to be there in their body to have a regular cycle. So the first and foremost rule for mainly for infertility patient is that stress that plays a major role. So I feel that the psychiatry and mental wellness is more important for these patients rather than other things that contributes more than 70 to 80%.
Yes, very rightly said, Dr. Kabila. So, such kind of patients, when consulted to psychiatrist, so is there any management available? How can you give us more elaborate on this aspect? How generally these patients are managed?
Yes. This, like as ma'am told, like the presentation will be different for the different age groups. Okay. When it comes to an adolescent, the primary problem is that they initially present with a lot of distress, body dysmorphism, body shaming, and also like with the low self-esteem, which is interfering with their performance in the either in the academics or in the society level. So the concept of self is lost there, so they are more vulnerable to go in for a lot of depressive disorders and lots of mood swings. This is at the functional level, but when it goes to severe level, they, because of the disorder itself or the treatment process and getting a lot of hormonal drugs will in turn cause lots of mental changes, including sleep disturbances, appetite changes, weight changes, and also mood swings. So when this goes into a disorder level, like if it is persisting over a period of time and it is not reversed by a simple counseling or so, or just a reassurance, then they fall into a category of psychiatric illness like a major depressive disorder and a bipolar disorder, or even like we have a lot of eating disorders common in this PCOS, which in turn complicates the picture of PCOS because already PCOD is associated with weight gain, and eating disorders is very common with people with PCOS. So eating disorders like anorexia nervosa or bulimia or binge eating again will cause a lot of bodily changes which worsens the hormonal disturbance. So it becomes a vicious cycle. Okay, and finally the patient will end up in a major depressive disorder with a lot of self-harm thoughts, which is very commonly seen and not given much importance in that. So in that case, it depending on the severity of the disease, it varies from initial just a supportive therapy, correction of or acceptance of treatment for the PCOS, and then it can extend up to starting them with pharmacological management, which includes apart from hormonal drugs, it includes like depending on the scenario, we start with mood stabilizers or antidepressants. Okay, and also will be supported with psychotherapy. There are different types of psychotherapy depending on the disease protocol. And finally, if the problem is so severe that patient may need inpatient care also. So understanding and early intervention of the problems is very important when we see that okay, something is wrong with me, and if the people or the public should have an awareness that okay, it is not only my physical body which is causing changes, also I am disturbed by mind, and they should be ready to accept the suggestions given by the gynecologist, because is the gynecologist first, the person first enduring is the gynecologist. So uh, people should be ready to accept the advices given by the gynecologist. They should believe removing the stigma about mental health awareness, and also they should be ready to consult a psychiatrist in the early stages. So early intervention, better prognosis.
Yes. So, yeah, thank you for this insightful and very informative this information. Definitely, I am sure that our viewers and the patients will benefit from this knowledge. All the experts are here, and they are linking these two conditions are very common in patients, and that really affects their real life. So it is not something which is imaginary and something which is out of just theoretical knowledge. It is real problem faced by women, especially in women. It is very common. So it is well said by a lady in one of the TED Talks that we cannot truly empower women without solving their health problems, importantly, mental health problems. So it is very important to approach this condition in both the ways. So what are at the end of this session, what you would like to give the concluding remark to our patients or viewers also, like how these two conditions deal together?
So, to be frank, when you are taking care of your mental illness, the menstrual cycles will get regularized, and even the infertility will get lessened. That's why in the earlier days, when you are getting married in the very early period, you don't worry much and you will be very playful, and the stress level will be little less. That's how that infertility cycles, everything was regular those days. But because of the lifestyle changes and everything, what we are worrying up much, and multiple tasks we are handling, the stress level and the mental well-being, that is getting affected. That affects our menstrual hormones. The main thing is the pituitary, which plays much more role in the PCOS. So we have to take care of our mental wellness to take care of the pituitary.
Dr. Vidya?
Okay, just to conclude, as rightly told by Dr. Kabilarajee, it is like cure. So the awareness about mental health and maintaining good mental health, and also reducing the stress level, should start even before the menarche period. Like addressing these issues even before the child or the girl child enters into puberty is much more important, and addressing the cycles in the women like during her life period is also important, and also creating awareness about good mental health apart from physical health and menstrual health plays a vital role in early identification of symptoms and also improving the mental health. Okay. That's it.
Yes. Okay, so great. Thank you very much, both of you. So we have reached at the end of this session. Before winding up, I would like to give my heartfelt thanks to both of you for coming here and sharing very important and valuable information with us, and sparing the time from your busy practice also, and bringing all the information which is there in the clinical practice to us, and what is the importance of dealing with these two conditions together. It is very important. Just dealing with one condition will not solve the issue, because another is still impacting the women, and especially the occasion is also great. The month what we are celebrating of PCOS awareness, the mental health awareness is that much important only. So with these brief words, I would like to end this session. Thank you both of you. Thank you so much.